Welcome back to You Heard It Here with Dr. Gary. I'm Gary, a clinical audiologist and part of the ownership team here at Advanced Hearing Group in Scottsdale, Arizona. The video that's coming out right here is one that's been a long time in the making. I've worked in the hearing healthcare field for the last 15 years, and I have spent that entire time explaining to patients how their health insurance works, trying to get them to understand the difference between copay, deductible, out-of-pocket. I'm going to try to simplify it. We're going to put some timestamps down in the video, so if you don't understand copays, jump to the copay section. If you don't understand out-of-pocket max, jump there. Those timestamps and description will be in the description below. I hope this video is informative and helps you understand your insurance on a very basic level. Disclaimer: if you are an insurance agent or if you are one of those people who really understands the nuance in insurance, yes, this is a very high-level explanation. I'm doing this in a way to try to allow people who don't get insurance to have enough understanding to be able to get through and kind of have a good expectation of what they're going to be owing and why they're going to owe it when they visit their doctor. There's a lot of misinformation that's on social media and the internet about the way things are billed and reimbursed. So we're going to try to basically make this make sense and kind of smooth out the transition so you understand what it's applied to and why. So today we're going to go through a few key terms and things that you need to understand. We're going to start by talking about copays. Then we're going to go to deductible, followed by coinsurance, out-of-pocket maximum, the difference between in-network and out-of-network, both for providers and facilities, and finally, the big one, the explanation of benefits from your health insurance company compared to a statement or a bill from your healthcare provider. They are very different. So let's talk about copay. The copay is the amount of money that you, as the insured, are expected to pay prior to being seen at a facility or a doctor's office. Now, your copay will vary depending on what type of doctor you're going to see. For instance, your primary care doctor copay may be $10, but your specialist copay may be $50. Or your ER copay may be $300, whereas your urgent care copay may be $150. It can be all over the place, and it really depends on your plan. Your copay is determined by your health insurance company, not your hearing healthcare provider or not your healthcare provider in general. Your doctor does not get to choose, oh, Susie Smith is going to pay a $50 copay today and Bob Smith is going to pay a $20 copay. That's not something that a healthcare provider has control over. You're bound by your copays with your health insurance company and with the particular plan that you've chosen or that your work chose for you. I understand sometimes we don't have a choice. So copays. Every time you walk through the door at your doctor's office, assume you will be paying your copay. Yes, there are some exceptions. There are some things like well visits that do not have a copay or do not apply to your deductible, but for the most part, again, keeping this simple, let's assume every time you go to the doctor, you will owe your copay. If you go to a specialist, it's your specialist copay. The ER, it's your ER copay. Your copays should be able to be found on your health insurance card or in the handbook that they sent you. If you don't know what your copays are, reach out to your doctor's office and see if they know what your copay is. Ask them prior to showing up for the appointment. Or reach out to your health insurance company and tell them, I'm going to see Dr. Smith. He's my neurologist. What should my copay be? And they should be able to give you a pretty good approximation of what your copay will be. So the first thing you need to know about your health insurance, many of them do have copays. Now, working in the hearing healthcare industry, I get asked all the time about Medicare specifically. Federal Medicare, that red, white, and blue card, they do not have copays. They do have deductibles and they do have coinsurance, but they do not have copays. So let's next talk about what your deductible is. All right, So when we look at deductibles, picture it like a bucket. Basically, the way it works is you need to fill your deductible bucket before your health insurance company will contribute any money. So if you have a plan that has a $1,000 deductible, by the way, good for you because that's actually a pretty low deductible, but if you have a plan with a $1,000 deductible, the first $1,000 in medical expenses is your responsibility as the insured. Your insurance company will not contribute anything. Now, that is not the first $1,000 billed to the insurance company. That's the first $1,000 reimbursed. So we're going to get into kind of the difference between a billed charge and an allowed amount in a little while. But understand, if your health insurance company says that they're going to reimburse the doctor $100 and you have a $1,000 copay, you will be responsible for the full $100. Now, there are some things that you need to know. So depending on how your plan is set up, you may have an individual deductible and a family deductible. Again, if you're a single person or you're the only person on your health insurance plan, it will be the individual deductible. But let's say you have kids or a spouse, then you will get pushed onto the family deductible. There are some nuances there, and we can do a whole video on deductibles where I go through that and break that down if that's wanted. But for right now, we're going to assume one deductible, make this easy. What you need to understand is if your deductible is $1,000, the first $1,000 of medical expenses is your responsibility as the insured. Once you've met your deductible, that's when your co-insurance kicks in. Your co-insurance is determined by your healthcare company. So basically, once your deductible's been met, then your health insurance company will start to contribute. They will start to pay your doctors. But they don't pay everything. So here's an easy example. You have an 80-20 plan. That means you have a 20% co-insurance. So once your deductible has been met, for every $100 in reimbursable medical expenses, your insurance company will cover $80. You will be responsible for $20. If it was a 75-25 split, your insurance company will be responsible for $75 and you will be responsible for $25. 90-10, insurance company pays 90, you pay 10. Pretty simple. Where it gets complicated is how long does that actually last for? Well, that's where your out-of-pocket max comes in. Now, before we leave the area of co-insurance, understand, just like deductible, that there may be a difference between an individual out-of-pocket max and a family out-of-pocket max, which may affect how one member of the family's co-insurance applies. But again, we don't need to get that far down in the weeds for you to understand that your co-insurance bucket basically needs to be filled, and it's not considered filled until you've reached your out-of-pocket max. So speaking of out-of-pocket max, what the hell does that actually mean? Well, the basic definition of an out-of-pocket max is the maximum amount of money that you as the insured will have to pay for covered medical services from in-network providers in a calendar year or a plan year, depending on whether your plan runs calendar year or plan year. So again, we're going to go through an example. Let's say your out-of-pocket max is $500. Your deductible is $250. So you pay the first $250, that fills your deductible bucket. That $250 also fills the first half of your out-of-pocket max bucket. Then your co-insurance fills the rest. Once you've paid your out-of-pocket maximum, you should not have any more medical expenses for in-network providers in a calendar year or a plan year. Your out-of-pocket max can comprise of a deductible, a co-insurance, and even drug costs, depending on how your plan's written. For example, my plan is written that I have a $5,000 deductible. I have no co-insurance after I meet my $5,000 deductible, but I do have an out-of-pocket max of $6,000. Now, how I get there is I am responsible for the first $1,000 of drug costs as well. So again, my $5,000 deductible coupled with my $1,000 of drug costs get me to my out-of-pocket max of $6,000. And yes, that is my personal out-of-pocket max. That is not my family out-of-pocket max. So you've really got these three different buckets. You've got your deductible, your co-insurance, and your out-of-pocket max. Once you've met your out-of-pocket max, you should not be paying additional medical fees for in-network providers. Which brings us to our next topic, in-network versus out-of-network. It is vital that you take a moment before scheduling an appointment with a doctor to either A, check on your insurance company's website to see if that doctor is in-network, or B, ask the question. Give them your specific plan. Are you in-network with my plan? Now, just because a doctor is in-network with, say, United Healthcare, does not mean that they are in-network with United Healthcare Plan XYZ42B. It's a made-up plan, clearly. But you can be in-network with a company as a whole, but not be in-network with one particular plan. So make sure you're giving the specific plan so your doctor can inform you if they're in-network or not. Sometimes your out-of-pocket max may vary between in-network and out-of-network. You may have a $6,000 out-of-pocket max for in-network and an $18,000 out-of-pocket max for out-of-network. So again, make sure you're asking your provider, are you in-network? The last thing we're going to talk about here, and this is huge, guys, is the difference between an explanation of benefits provided by your health insurance company and an actual statement or a bill. Now, you're going to have several different columns when you get your explanation of benefit. I'm going to give an example here. And please understand, I'm using generic terms. They don't always use these same terms, but it should give you a pretty good understanding.
It really is amazing the confusion behind an explanation of benefits compared to a bill. So let's take a look at a made-up explanation of benefits so we can try to make this simple. The first thing you're going to see is a procedure code. Now I'm using procedure code 12345 through 12348. So we did 4 different procedures with this patient. The next column over is the billed amount. That's the amount of money that is being billed to the health insurance company. The amounts in this column are absolutely irrelevant. You can just go ahead and ignore those. The next column is the plan discount. This shows you how much the plan discounts from the billed amount in order to get you to what is most important, which is the next column, the allowed amount. That allowed amount is the amount of money that your insurance company would pay for procedures being provided, assuming that you've met your entire co-insurance, deductible, and all your co-pays. Now, because we're talking about what to expect to pay and how this applies to statements, let's now take a look at a plan that has an 80/20 co-insurance with a $100 deductible. Let's look at procedure code 12345. We can see that the billed amount, again, go ahead, ignore that, is $150. The plan discount is $80, leaving an allowed amount of $70. Amount paid is marked at 0 because $70 was applied to the patient's deductible. That means the entire allowed amount went to the deductible. Now when we look at code 12346, we can see it was billed at $86 with a plan discount of $42, an allowed amount of $44. The amount paid is $11.20. How they got there was the first $30 was applied to the deductible, and then $2.80 was applied to the co-insurance because this is an 80/20 plan. Now, for simplicity's sake, again, we're going to drop down to the last code, which is 12348. Billed amount of $44. plan discount of $34, leaving an allowed amount of $10. We see that $8 was paid by the insurance company, $0 was applied to the deductible, and $2 was applied to the patient's co-insurance. Again, that gives us our 80-20, $8 paid by the health insurance company, $2 by the patient. So how does this equate to what you should be owing and paying? If you add up the columns for deductible and co-insurance, that is the amount that you will likely be receiving in the mail as a bill from your healthcare provider. I hope this kind of clears up the difference between the explanation of benefits, the billed charges, the allowed amount, the plan discount, and then deductible and co-insurance and how they're going to appear on your explanation of benefits.
All right, so we're going to try to sum this all up, okay? Basically, insurance is complicated. It's a very nuanced topic that we could spend all day talking about. I could honestly put out 15 to 20 minute videos just talking about the different types of deductibles and co-insurances and things like that. And I'm trying not to do that. We want to keep this simple. So insurance is complicated. Understanding the basics of your plan, not of every plan, but the plan that you're on, will help to save you time, money, and prevent frustration. If you know every time you walk into your doctor's office, you're going to pay $20, that makes swallowing that a lot easier. With insurance being complicated and nuanced, understand that there are as many plans as there are people. Not quite, but there are a lot of different plans. So just because you have a United Healthcare plan and your sister Susie has a United Healthcare plan, it doesn't mean that your plans are the same. You guys may have different co-pays, different deductibles, different co-insurances, vastly different out-of-pocket maximums. You may have a bigger network or a smaller network. You may have totally different premiums. Insurance is complicated. Take ownership of your plan. Try to understand at least the basics. Save yourself time and money and frustration by understanding the basics. Finally, insurance and medicine are both businesses. Businesses need to make money in order to keep their employees employed and to provide you the services that you need. If your primary care doctor's office is not getting paid, either by you or by your health insurance company, they can't keep the doors open and the lights on to be able to see you and provide you the health care that you need. So understand, when you go to a hospital, or when you go to an urgent care, or when you go to your primary care doctor's office, that is indeed a business. The whole goal of the business is to provide a service for payment. The insurance company does help a lot with the payment, but again, with all its nuances and the bucket here and the bucket there and the deductible and the co-insurance and the out-of-pocket max, you may end up owing something. Don't be surprised if 3 months after you see your doctor, you get a bill in the mail. Believe me, it's not that your doctor didn't want to get paid. Sometimes it takes us that long to get paid by the health insurance company. Just make sure you try to understand the basics, help prevent your own frustration. This has been You Heard It Here with Dr. Gary. If you have any questions, please list them in the comments section below, or if there are any other videos that you want to see on this topic of healthcare in a very basic level, let me know. I'll try to get a video out about it. Again, I hope you enjoyed this, and I hope the timestamps in the description were useful. This has been You Heard It Here with Dr. Gary. Thank you for watching. We'll see you in the next video.